Assalamualaikum and a very good morning. My name is Zuraida binti Jalil, matric number 8401231155720001. I am the student from Bachelor of Nursing Science with Honor from OUM. Today I'm going to present my research proposal, which is the topic the effect of emergency department overcrowding on the timeliness and accuracy of nursing clinical decision making. The introduction of my topic. First, emergency department (ED) are critical for acute and life-threatening care. Number two, nurses play a central role in triage, assessment, and intervention. Number three, overcrowding is a global issue affecting timeliness and accuracy of decisions, and the aim is investigate how ED congestion impacts nurse decision making and patient safety. This study aimed to investigate the impact of emergency department congestion on the promptness and precision of nursing clinical decision making. This research seeks to elucidate the impact of systemic pressures on frontline nurse performance and patient outcomes. The results will enhance evidence-based techniques for optimizing emergency department efficiency, assisting nurses in high-demand environment, and ultimately ensuring patient safety. Resolving this issue is essential for improving clinical practice and guidance, policy and resource distribution in emergency healthcare system. The background of my study: ED overcrowding, demand exceeds capacity, causes rising patient load, limited inpatient bed resource constraints. The consequences: delay interventions, extended waiting times, and increase the stress. So the nurses face cognitive strain, risk of errors, and compromise patient safety. The study is positioned within the wider framework of emergency department congestion and patient safety, intending to enhance practical remedies. The results will guide attempts to streamline emergency department operation, augment nursing support, ultimately better patients' outcome in emergency care settings. Now we go to the problem statement. Chronic overcrowding undermines timeliness and accuracy of nursing decisions, leads to increased morbidity, mortality, and medical errors. Limited research directly links overcrowding to nurse decision making, needs for evidence-based interventions to support nurses and improve outcomes. The study aims to examine the impact of emergency department congestion on the promptness precision of clinical decision making, offering insight that can guide policy, practice, and resource distribution in emergency care environments. My research questions divided to general and specific. The general questions: impact of ED overcrowding on timeliness and accuracy of nursing decisions. For the specific: effect on workload and stress, correlation with timeliness, impact on accuracy, consequences for patient safety, and strategies to improve efficiency and support nurses. In my research objective also, we have general and specific. For general, examine impact of ED congestion on nurse decision making and patient safety. For the specific objective, we want to evaluate correlation with workload and stress, assess timeliness and accuracy of decisions, link decision making quality to patient safety outcomes, and provide evidence-based recommendation for ED efficiency. For the hypothesis 1, overcrowding increases nurse workload and stress. Hypothesis 2, overcrowding reduces timeliness of decisions. Hypothesis 3, overcrowding reduces accuracy of decisions. Hypothesis 4, reduce timeliness and accuracy, poor patient safety outcomes. And hypothesis 5, targeted solution improve decision making and patient safety. Significance of the study: clinical practice, evidence to improve timeliness and accuracy. Clinical practice: it will furnish evidence on the impact of overcrowding on nurses' capacity to offer timely and precise treatment. Comprehending these consequences can inform strategies to mitigate delays, diminish mistakes, and enhance patient safety. For the policy and management, guide staffing, triage system, and resource allocation. Policy and management the findings will elucidate the systemic effects of overcrowding for hospital managers and policymakers, therefore aiding in decisions about staffing, triage system, and resource allocation. Evidence-based suggestion can facilitate adjustment that improve emergency department efficiencies. For the academic contribution, address research gap on nursing decision making. Academic contribution, although previous research has investigated overcrowding in general, limited studies have particularly addressed its impact on nursing decision making. This research will address that deficiency, enhancing academic understanding, and provide a basis for further inquiries. Patient outcomes safeguard against adverse events in high demand EDs. Patient outcomes: the study underscores the direct effects of overcrowding on patient safety by correlating it with timeliness and accuracy. Findings can inform the development of interventions that safeguard patients against unfavorable occurrences in high-demand emergency department settings. For the literature review, ED overcrowding define and cause patient volume, limited beds, inappropriate use. Consequences: delays, errors, reduced satisfaction, increased mortality. Nursing decision-making: timeliness and accuracy compromise under pressure, and research gap. Few studies focus specifically on nurses' decision-making. According to Alton and Kudu's 2025, patient-related factors such as chronic illnesses, aging populations, and low health literacy also contribute to overcrowding. And according to Hood and Aronsky 2008, clinical decision-making involves both timeliness, how quickly interventions are initiated, and accuracy, how correctly patient conditions are assessed. Overcrowding creates cognitive overload, time pressure, and communication barriers, which can impair nurses' ability to make safe and effective decisions. The theoretical framework: we are choosing Donne-Bedien's model of healthcare quality 1966. Structure: ED capacity and resources. Process: nursing decision-making, timeliness and accuracy. Outcomes: patient safety and quality of care. Conceptual framework links overcrowding, workload and stress, reduce timeliness or accuracy, and compromise safety. For the methodology, design quantitative cross-sectional survey. Study design: this research will utilize a quantitative cross-sectional methodology to investigate the impact of emergency department congestion on the promptness and precision of nurse clinical decision making. A systemic questionnaire will be employed to gather data from nurses in emergency department, allowing statistical investigation of the correlations among overcrowding, workload, timeliness, accuracy, and patient safety results. This design is suitable since it facilitates the detection of correlation and pattern within a specific population at a singular moment in time. For the study setting, Columbia Asia Hospital Bukit Rimau Shah Alam in Kota Kemuning, Shah Alam, Malaysia, will host this trial. The private hospital offers extensive medical services to the neighborhood. Emergency and urgent patients initially visit the ED, a vital hospital facility. The ED averages 60 patient visits each day, excluding outpatient consultant clinic referral. Referred patients typically need ED care and stabilization while waiting for insurance permission to be admitted to the ward. Adding patients to the department's workload and complexity increases care delivery. ED functional regions include triage, green zone, yellow zone, red zone, and asthma bay. Only 4 nurses cover all these regions every shift. This staffing ratio shows how much ED nurses are asked, especially amid congestion. Nurses must treat mild cases in the green zone, life-threatening crises in the red zone, and specialist conditions like asthma. The study environment illustrates how low staffing, high patient load, and systemic stresses can delay and impair nurses' clinical decision making. The study in this setting will reveal how overcrowding impacts frontline nursing and patient safety in emergency care. For the population and sampling, emergency department registered nurses at Columbia Asia Bukit Rimau Shah Alam will be the research population. These nurses actively triage, assess, and make clinical decisions in the ED triage green, yellow, red, and asthma bay. Purposive sampling will target nurses who experience congestion and clinical decision making. For the sample size calculation, the ED of Columbia Asia Hospital Bukit Rimau Shah Alam has 20 licensed nurses. To calculate sample size, use Slovin's formula. The sample size will consist of 90 nurses. This guarantees that the majority of the emergency department nursing personnel are represented, ensuring enough statistical validity while preserving the feasibility of data collecting. The instrument, standardized questionnaire, demographic workload, timeliness, accuracy, and patient safety. For the data collection and ethics, self-administered surveys using paper or electronic, pilot study with 5 nurses for reliability, ethical approval from IRB and hospital, and informed consent, confidentiality, and voluntary participation ensured. For the data analysis plan, descriptive statistics, mean percentage and standard deviation, inferential statistics, correlation, overcrowding versus timeliness or accuracy, regression, predict patient safety outcomes, ANOVA difference by experience or qualification. The expected outcomes for this research project is to clear evidence of how overcrowding impacts nurse decision making. Number two, identification of systemic pressures affecting timeliness and accuracy. Number three, practical recommendation of ED efficiency and nurse support and contribution to policy practice and academic knowledge. Conclusion of my study: ED overcrowding is a critical global issue. Nurses' decision making directly influence patient safety. This study will provide evidence-based insight to improve care quality, and findings will guide clinical practice, policy, and future research. With that, thank you for my presentation.